One of the things that most people come to me for is weight loss resistance or some of the metabolic changes that happen, weight redistribution, we'll say,
Yep.
again, under the influence of estrogen. Can you speak a little bit about, do you have women that are coming into your
Ugh.
practice that are talking about this?
Yes, all day, every day, all day, every day. And this has really been a really interesting experience for me because, it's been a struggle for me also. And I mean, obviously this is like your area of expertise, but here's the thing. I think the gaslighting about, I think there've been some really big studies that have come out in the last couple of years that I've seen really promoted online. See, it's not really happening. The data doesn't show that women gain weight any more than men. And I feel like that's really gaslighting. I mean, we have hormonal
Ask any
changes.
perimenopausal woman
It's
if
absurd.
that's true.
It's just absurd.
Come
it's absurd.
on. Yeah.
It's absurd.
It's usually the
just,
gym bros. I'm just going to say it. It's usually the gym bros that have huge followings that talk about this.
Yeah, a lot of them are
Yeah.
doctors. And I'm like, you know what? Do better, sir and madam. Because I've seen women doing this too.
Yeah.
And I'm just like, I don't really know what planet you're on, because there's reams of data on the fact that weight may not change, although it usually does, but weight distribution changes. And here's of course, it's belly fat and visceral fat, which is dangerous for us.
Yes.
It's dangerous for us. It is, you can't, it's true that your lifestyle can't spot treat subcutaneous belly fat, but it is not true that lifestyle cannot treat. Let me stop doing all the negatives. It is true that lifestyle can treat visceral fat. And that is what we want to lose. So look, do I want to look a certain way? I do. I really do. But I'm at this point a lot more concerned with my health. So I had gestational diabetes. I am an Ashkenazi Jew. There's a lot of diabetes it turns out genetically, and there's probably some epigenetic influences there too, trauma and other things, right? But I know that is something that I need to be concerned about. And so, by the way, I'm bringing this up because if any of your listeners were pregnant and had gestational diabetes or preeclampsia, hypertension during pregnancy, when you hit menopause and perimenopause, please don't let people dismiss you, because your risk of diabetes, insulin resistance, and hypertension and cardiovascular disease, which as we know is the number one killer of women, skyrockets. Your cholesterol skyrockets. Your hemoglobin A1C can skyrocket. Your inflammatory markers may look normal, but you're developing visceral fat, which is just an inflammation factory. So that can be managed with heavy lifting, increasing protein, increasing fiber. I'm not a fan of restriction diet culture. I have my own disordered eating history. I'm super honest with this about people. I really get my patients because I am one of them. Yeah. And I have had my own struggles with body image and all this kind of stuff. And again, as I'm repeating myself, I mean, I really want us to focus on loving ourselves enough to be healthy and look at the health implications. But I think when we make it really binary, Stephanie, health at any size is over here and, skinny is over there. No. That's not actually how this works. There are some actual metabolic changes that are occurring in women under the influence of the changes of our hormones. The other thing to understand about this is that you can do things, you can change things, and you can focus on health without getting crazy and just going into eating disorder land, which isn't going to help you. Because as we all know, there are also, if you look at some of these interesting studies where they can do CT scans and MRIs where they're showing the fat distribution, you could have a skinny person with a shit ton, excuse my French, of abdominal fat, visceral fat. And these people they may be fitting into their size 0 genes, but they're actually not healthy.
Those are, what are they? TOFIs, I think they're called. Thin on the outside, TOFI. So thin outside, but fat on the inside. And when we say fat, we're saying visceral fat. Yeah.
Yeah. Visceral fat. So there has to be a balance between self-love and acceptance and, being real about what are the health concerns. I think there was one more thing that, of course, my brain fog is preventing me from remembering. So again, to the evolutionary biology people, there is some thinking that the belly fat that we develop, we do more conversion of estrogens in that fat. So remember, I talked about the ovary is really the source of estrogen for us. But the truth is that you do have adrenal hormones. So the adrenals are the cute little guys that are, or girls, whatever you want to call them, sitting on top of your kidneys. And you make a precursor hormone there called DHEA, which can be routed by aromatase, an enzyme, either to testosterone or estrogen. And actually, the fat that we make in our belly can be routed toward making some estrogen. Now, the thing is that this estrogen is not necessarily the most beneficial kind of estrogen, but it is estrogen. And I feel like it's our body trying to help us. So sometimes when I tell people that, I'm like, look, your body's trying to help you. So like, understand that, when we get into like this war with our body, it's just never good. Like, you're not going to win. And I don't think it's healthful or helpful, but there is maybe a reason why your body's trying to do that. It's trying to preserve your brain. It's trying to preserve your bones. It's trying to preserve your heart. It's trying to give you a little bit of estrogen to get you through the next big chunk of your life.
I really like that reframe. I think that it reframes fat in general, so whether that's subcutaneous, visceral fat, it's the, I've spoken to individuals who talk about this with the same, with Alzheimer's disease, when we see some of these beta amyloid plaques. So Dr. Dale Bredesen will say, these tau tangles and these beta amyloid plaques, we used to look at them as this thing that needed to be removed and they're evil, but it's actually the brain's protective mechanism from a variety of insults, right? I've heard researchers talk the same sort of line of thinking around cancer, that cancer is the body's response. Now, I'm no endocrine, I'm not an oncologist. I wouldn't know enough to intelligently speak about that, but some conversations that I've been privy to talking about this idea that cancer is also a response to a variety of environmental, and exogenous insults. And that's it's a bizarre, of course you think about it, you're like, why would your body do that to yourself? But it is a self-preservation mechanism, the same as an amyloid plaque might be.
Yeah. Yeah.
And you mentioned, I just wanted to talk about cardiovascular disease for a moment. And I'm so glad that you brought up that you are a breast cancer survivor. I actually pulled some stats in prep for our conversation, but knowing your history a little bit, because you've spoken about it online. Cardiovascular disease is, as you said, the number one killer of women, full stop. Like, it kills more women than the next 16 causes of death. And that includes all cancers, AIDS, acquired immunodeficiency syndrome, and motor vehicle accidents.
Wow.
It is the number one killer. And then I also, if you can just allow me to nerd out for a moment, the risk of developing cardiovascular disease versus the risk of developing breast cancer. So women have a 1 in 8 risk, so about 12%. If you divide 1 into 8, it's about 12% risk of getting breast cancer. For cardiovascular disease, it's more than 1 in 2. It's 56%.
Yeah. Yeah. Most breast cancer survivors are going to die of heart disease.
Right. Okay. Next point. I just want to throw this in here just to make sure we have this in the ledger. One, the risk of dying, lifetime risk of dying from breast cancer, 1 in 38. So 2.6%. One risk of dying of heart disease, 1 in 4. So it's like there's the 25%. So there's like 2.6 to 25, like it's a 10x difference there. So as you said, women who've had breast cancer, they're most likely going to die from cardiovascular disease.
Yep.